Segue.
Let's segue.
Let's talk about the PT, the exercise, the physio. Okay, so what role does that have when treating this problem, tendinopathy?
It has to be done. This is where, when I was talking, tendons are workhorses. Tendons want to work. This is where they can, under a controlled environment, place tension on the tendon so it can repair itself and adapt. So you got to put tension on that tendon in order for it to heal. And that's where physical therapy comes into play. And there's a bunch of different ways that you can contract a muscle that's pulling on that tendon to get it to work. And I think it was in the 80s or 90s, eccentric loading was like all the rage. You got to eccentrically load it, and it still is. Let's not question that. Eccentric loading is still a big component of creating that tension for that tendon.
So eccentric, there's strain. So real quick, what's eccentric mean?
Eccentric is elongated. So think of like you feel like you're going to a stretch, but you have a load. So so the tendon is being pulled under weight. That's the best way I can describe it.
Right. Okay.
Yeah. Versus concentric, where I always think of biceps curls as like bulking up, real short, quick contracting. So you're pulling the weight up.
Gym bros.
So
gym bros, it's the negative.
It's the negative. Yeah. There you go.
Yeah. My curls here, I'm lowering it down.
Yeah.
That would be an eccentric,
yep,
right?
That's it.
Okay. All right. So loading the tendon is what the tendon wants. And it's what stimulates reparative response.
Yeah. And then, but there's a limit. Too much of a good thing is no longer a good thing. So there is a balance.
Yes.
And this is where your physical therapist comes into play. There is, you want someone to be guiding you through that. And that's why I'm like, home exercises, they're lovely. They are, but you need to know what you're doing. And that's where I need you to go and see a physical therapist, have that guidance to go through that properly. Because if you're doing too much or even too little, you're not helping yourself. So there is that tension curve, stress and tension curve that you have to take in consideration. The physical therapist will guide you through that. But there is a little element of pain, and that's something that needs to be talked about whenever we see patients. It's like, this is not going to tickle. This is not a warm, fuzzy blanket. There's going to be a little bit of pain associated.
Yeah.
And it's like, you're laughing, but I mean.
No, it's true. It's very true. And I actually see this in post-op patients as well, where say they have a big rotator cuff tear. I fix it. The tendon is healed, technically, but the tendon still has tendinopathy finding. It's like, I'm not making the tendon 15 years old. The tendon's still 65 years old, or still has that process going, but the tendon is now healed. It's in continuity. And then patients can come back, have similar pain. The tendon is healed, and they've stopped doing their maintenance program. Wow. And so their symptoms have recurred.
Yep. Welcome to it.
Very common.
And I tell people, I'm like, this is a process that is a marathon. This is not going to get fixed in 2 weeks. I lovingly say I don't have fairy dust, magic wand, or a magical bean that's going to make this go away in a couple weeks. This is going to take months. We're talking, I will see you in like 2 months, 3 months, but I'm only expecting about 50% improvement. Real talk. 50 to 60%. That's all I'm expecting in that time. And that's with physical therapy and doing your home exercises along with that your physical therapist gave you. This is a long process. Remember, your problem started a long time before you started having symptoms. Months, years. Hard to say. I don't have that time machine to be able to go backwards, right? So you have to understand it's going to take a long time to recover. I mean, depending on what literature you read, it can take up to a year. And that's with dedication. So I tell my patients, like, you'll be discharged. You'll graduate from physical therapy, but you didn't graduate from the exercises.
Right.
It will come back if you don't keep up with it.
Right. Yeah, absolutely. And not only are you trying to load the tendon and just load the tendon, but if you've developed those compensatory movement patterns,
we got to correct.
And your joint is stiff, you have to correct the joint stiffness, the muscle tightness perhaps that's developed, and you have to load your tendon.
Yep.
So it's like all these things together to get better.
Yeah. And again, this is a huge thing. And I think medicine is gravitating more to the patient buy-in and really making a collaborative effort. And again, I even tell patients, like, knowledge is power. I'm like, I don't ask you just to do things just for the fun of it. Let me explain the why. Why am I asking you to do this? Why am I telling you that this should work? I don't ever say is going to, because that's a promise I can't make or keep, but should work. And this is the reason why. And it's that dedication, and it's figuring out, how are you going to do it? I'm not going to shadow you around. Your physical therapist is not going to shadow you around. I need your buy-in. I need you to find that dedication to it.
Do you get a lot of looks when you suggest therapy still?
I do. And I go, don't judge it yet. I go, don't judge it yet. I go, here's the thing. There's a lot of different other modalities they can utilize. A lot of it is still kind of like plus minus in it. Everywhere you look, tendinopathy is an individual journey. Everyone's journey with tendinopathy is going to be a little different. What their treatment's going to be and what is going to require for them is going to be different. So don't write it off, because there's dry needling that can help. There's electroshock wave therapy. There's laser. There's ultrasound. There's a lot of different modalities that in physical therapy they can utilize. These are options, and you may need to use the whole spectrum to supplement and adjunct to the therapy that you're getting.
Yeah, I definitely, maybe less so than I used to, but I definitely still get looks. And a lot of those looks come from guys that they're strong. They do a heavy duty job, and they are strong, but and so when they get the hey, you need therapy to do this, they're like, this makes no sense to them.
My favorite is gluteus medius tendinopathy. My favorite, because when I get them to do hip flexion or hip external derotation, they can't beat my two little fingers, and I just drop. I go, so about that strength you say you have.
Right, exactly.
It's like, you just boosted my ego, and that's not okay.
Right.
It's like, this is what's not being focused on. It's like, keep going to the gym. I want you to go to the gym. Use pain as your guide. If it hurts, back off. But I need you to go to physical therapy. I need you to pay attention to the less showy muscles.
Right.
Okay.
Right.
The guys that don't get the attention but do all the work.
Yes, exactly. The ones that hold you up.
Exactly.
So I want to bring up a couple things that I learned from some of the information you sent me that I thought was really, really helpful. And it'll be super helpful to patients. I'm going to probably use this line at least 10 times today when I start clinic. So, quote, moderate tendon loading is anti-inflammatory.
Yes.
Who would have thought?
Again, tendons like to work.
Yes.
Put them in the environment they're comfortable in.
Yes. I can't say that. I'm going to say it one more time. Moderate tendon loading is anti-inflammatory. And of course, as we said, regenerative. And what you said earlier about it can't be too little, it can't be too much. So true. Yep. So statistic. So this is a little bit of laboratory stuff, but in the lab, in this particular study, they loaded the tendon, I guess 4%, which means it elongated by 4% of its resting length or something. Yep. And if they loaded it just at 4%, that was enough to create the anti-inflammatory response. But if they loaded it to 8%, it was detrimental. Yep. So there is this sweet spot for sure. Yep. And that's why we need the supervised therapy, or at least lots of education, and then the patient can do it on their own.
Correct. And again, it needs to be emphasized. It's not pain-free. It's not pain-free. You need to have something there. You need to feel a little work. But I'm not asking you to go into a place of tears. We're not trying to do medieval torture here. We're not on that stretching device, okay? That's not what we're going for. It's moderation, Goldilocks.
So yeah, absolutely. And so when I read this, I was trying to figure out, okay, nobody knows when they're stretching their tendon 4%. So I came across some studies that use the visual analog, or what is the visual analog scale?
Yep.
So essentially, for those who don't know, it's essentially a scale 0 to 10.
Yeah.
And you might have seen the little smiley face, and then it gets I'm not so happy face, and then all the way at the end, like I'm crying face. So on a scale of 3 out of 10, the patient's own perception was what the studies that I read had used to know when you're doing too much. So go to pain about a 3 out of 10, and you're probably or hopefully within that ballpark where you're causing an anti-inflammatory effect and a regenerative effect.
Yeah, it's like where you go, okay, I'm feeling it.
Yep.
And not to the point like, oh my goodness, stop.
Right.
Clearly that's like overshooting, but it's okay, I'm feeling it. It's not horrible. I might be a little nervous to keep going.
Yeah.
It's that warning place that you need to take into account.
Critical. Yes, critical. Okay, so you mentioned, how long do we have to do therapy before we start feeling something?
Yeah, I tell people therapy, I tell people 8 to 12 weeks. And again, when you come back and see me around then, I'm not expecting world changes. If you come back 100%, great. Love it for you. Great, wonderful. My expectation, though, 50 to 60% improved.
And then it doesn't stop there, right? This is, so there's active measures where you're actively participating in your own treatment, and passive measures. Tendon problems, tendinopathy, it's not like it's not like you got to take a pill for your high blood pressure and your blood pressure comes down and then you're done for the most part. You have to be very active in your own treatment.
This is a very dynamic treatment journey. Yeah. It's not to be idle at all.
Right.